Welcome to the Strive Learning Lab. My name is Annie Holmes and I work with the Strive Research Consortium. We have partners in the UK, in South Africa, in Tanzania and in India, as well as partners in associates in Uganda and also in the US. We have a number of presenters today from Strive's working group on alcohol and HIV. You're going to be chaired by one of the co-chairs of that working group, Dr. Jerry Mshana from Tanzania. So I'm going to hand over to Jerry now, and thanks very much.
Thank you very much, Annie, for that introduction. So welcome, everyone. So today we're going to present results or findings from a study that we conducted in 3 countries, in South Africa, Tanzania and India. And the study basically used participatory methods, and it explored youth perspectives on alcohol. And we were specifically looking at issues around availability and marketing in the 3 countries. So we'll have a team of presenters from the different countries. Just as a background, the harmful use of alcohol is responsible for 60% of all deaths globally and contributes to many diseases, over 200, which have been documented. Alcohol use is one of the distal drivers of the HIV epidemic in the developing countries. So Tanzania and India and South Africa are in the developing country category. And the consumption of alcohol exposes young people to a variety of health problems and risks, but also public and social problems. So things like antisocial behavior, needle sharing among injecting drug users, which puts them at risk of infection or various illnesses, multiple and concurrent sexual partnerships, sex without condoms, and violence, including sexual violence. So all these are issues that are important or make important to explore the use of alcohol, especially in this population.
The objectives of the study were to document the availability, the pricing, packaging, advertising, and marketing of all alcohol selling outlets in the 3 countries. We also wanted to explore young people's perceptions of those available outlets, how alcohol is promoted, how it's packaged, and the pricing in their respective countries. Lastly, we wanted to explore young people's drinking patterns, the norms around how they drink, as well as any associated sexual risk behavior and any sexual violence. In terms of methodology, we employed 2 types of methods to collect data. The first one was geographic information system, where we used GPS gadgets to collect all the GPS coordinates of alcohol selling outlets. And this was really to look at the proximity of these outlets to educational institutions. We also mapped all the outdoor advertisements in the communities that we were working in, and we used a standard template across the countries to observe any data outside of the outlets, such as operating hours, the type of venue that it is. Is it a bar? Is it a club? Is it a liquor store? Is it a restaurant? We also then noted if there was any form of advertising outside of the outlet, as well as a sign that then states the minimum legal drinking age. We then used Quantum GIS software, which is an open software that allows you to put all the GPS coordinates in the form of analyzing them and then seeing how dense the outlets were. Second methodology was participatory action research in the form of Photovoice, and this methodology allowed participants, in this case which were young people, to use photographs to document their world, their experiences, as well as caption those photos to allow them to give meaning to what they're about. So young people were then recruited in their respective sites purposively, and we trained them and gave them cameras And the training entailed 6 workshops that taught young people basic photography skills, camera safety, and techniques of how to take various photos to, symbolize how they perceive alcohol. They were also given homework throughout the 6 weeks that we saw them, where they took photos of all the alcohol outlets. All the alcohol adverts they come across as they move around in their community, be it to a school, to be with a friend, to church. As they move around in the community, they then we also then had focus group discussions that were structured as well as facilitated using those photographs that they took. Young people then had an opportunity to caption their photos, edit them in order to then display them through an exhibition. The focus group discussions were recorded, they were translated, and we transcribed them verbatim. We then used Atlas TI and InVivo as softwares to analyze for themes that were emerging. Tanzania and India also undertook a process of reviewing the policy and legal documents to understand the policy context in their countries. In terms of the sample, we recruited young people that were between the ages of 18 to 24 years old, and in South Africa, we were looking at young people that were in and out of school in Gauteng, Gauteng was the urban side, and then Mpumalanga was the rural side. In Tanzania, they recruited young people who were with formal employment as well as those who were who were with informal employment. This was in Mwanza and Kilimanjaro. In India, young people were recruited from Mumbai, the low as well as the high income areas. These were college students as well as employed students. And when we ran the focus group discussions, we had mixed groups as well as those that were disaggregated by gender.
This study has a lot of results, but today the presentation is going to focus on a few results around the themes of alcohol advertisements, marketing, and norms. So the big highlight findings are that alcohol advertisements and selling outlets were found to be in near proximities of schools and colleges in all 3 countries. This despite being banned, the advertisements being banned in India, they were allowed in South Africa and Tanzania. We also found that advertisement messages were targeting youth, and advertisements do emphasize how cheap alcohol was as a means to promote and market alcohol. Furthermore, the research result also show that how some advertisements promote various notions that young people look up to, like, for example, notions of masculinity. Our Photovoice data threw a light on a lot of perspectives from the young people, and one of the biggest findings there is that young people did recognize sexual risk and increased violence as a consequence of alcohol. So if you look at this map, the mapping exercise in India took place in the city of Mumbai. City of Mumbai has a high density of colleges, so we were looking at schools and undergrad colleges. The city of Bombay roughly can be divided into 3 clusters where maximum educational institutions were clustered. So we mapped these 3 places. In all, we mapped around 144 institutions in each of the in all, and over 50 outlets in every of the in each east, west, and south of Bombay. We found that across these 3 places where we mapped, there is a consistent accessibility of alcohol shops from colleges in all 3 regions. We began with 500 meters, but then realized that the consistent availability was also within 100 meters. Particularly in case of 5 colleges, liquor availability was within 50 meters. And in south of Bombay, if you look at the map on the right-hand bottom, the red stars are the colleges, and the pink triangles are the bars, and the green dots are the rest of bars. That was where the maximum density was found. In a couple of cases, the alcohol outlets were right outside colleges. Most of these places displayed all the warnings, yet they were placed right outside colleges, which is against the law. In India, in Mumbai in particular, most of these outlets were not shacks, but they were restaurants that also sold alcohol, which made it easier for young people to access the shops as it was less taboo and less stigmatizing.
So in South Africa, we also found that there was a high density of alcohol outlets. This was both in the rural and the urban side. So the map that you are looking at is from the urban side. We found that there were 140 licensed outlets, and all these outlets were actually within a 500-meter radius to schools. So when you're looking at the map, the red stars are outlets, the yellow circles with blue stars are schools, and in blue are the billboards or the posters for advertising. So in addition to finding that schools are within a 500-meter radius, outlets are within a 500-meter radius to schools, where the law clearly stipulates that they are not allowed to be within a 500-meter radius to schools. There were issues of lack of compliance, lack of monitoring to ensure that there's compliance. We also found that 76% of these outlets had some form of advertising outside of the venues. This was in the form of pricing, specific alcohol beverages. Furthermore, we also found 15 billboards and posters which were on the main roads throughout the township of alcohol advertising.
So similar to the India and South Africa maps, in Tanzania we also saw a fairly high density of alcohol outlets and advertisements in both of our study sites. And we saw that outlets and adverts were also located in close proximity to schools. So this map shows our Mwanza site, and we can see that on the map, the blue and the white boxes show outlets and adverts, and the red stars on the map show the schools in the area. The blue circles show a 500-meter distance from each of the schools. And what we found is that we saw within 500 meters of every school in this particular site, there were between 10 to 27 alcohol outlets and between 6 to 11 alcohol advertisements. And another thing that we also saw that was really interesting is that most of the outlets, not just within the school area, but basically around the entire area, were actually open before the time that's actually required for them to be open. So now I'm going to share with you some of the lovely photos from our Photovoice exercise. And just to point out, some of the photos that I'll show later on in the slides, specifically the ones that show the consequences of alcohol use, are not necessarily depicting actual situations, but they were acted out by the study participants. Some were acted out by their family members and their friends. So during the Photovoice exercises, young people took pictures of alcohol adverts that they see daily, and they discussed how these adverts were perceived among young people. And alcohol adverts in all of the three sites, in India, Tanzania, and in South Africa, were considered to be fairly attractive and appealing to young people. So for example, the quote on this photograph that you can see here says, "Just by looking at the image of this alcohol, you want to try it." And then we also saw that alcohol promotions, such as competitions and events that involved celebrities and alcohol price discounts, were also discussed to encourage heavy drinking among young people. So the quote below is from our South Africa side, and just basically talks about ladies' night and how ladies' night basically brings in girls of every age, even girls who are below the age of drinking, and they're sort of allowed to purchase and to drink. So young people also noted how aggressive alcohol marketing to youth focused mainly on emphasizing an appealing lifestyle that's linked to alcoholic beverages, and also fancy drinking venues and alcohol packaging that allows young people to easily carry bottles in their bags or in their scooters. So as Preeti mentioned earlier, alcohol advertising is banned in India. However, it is allowed in Tanzania and South Africa. But from this example, the photographs on the left, you can see how social media is actually being used to advertise alcohol that's specifically targeting young people. So this quote basically elaborates and talks about how Facebook is always giving notifications, and you get notified every time there's a deal or there's an event. Young people also discuss aggressive alcohol marketing and the location of alcohol outlets in school areas, despite existing restrictions. So we can see, for example, in the photos on the right, which were taken to show an alcohol outlet and advertisement located right outside a school. And this is from our India side as well. So young people also acknowledged how alcohol advertisements are gendered. And in South Africa and in India, adverts were actually discussed to be gendered to target either men or women, whereas we saw in Tanzania, we only saw alcohol adverts that specifically targeted young men. Adverts targeting men in all sites mainly advertised beer and attributed it to qualities of masculinity, physical strength, success, and sportsmanship. So, for example, you can see the photograph on the right, which is an advert for Safari beer from Tanzania, and the slogan basically translates to a champion beer for champion men. Adverts that were targeting women mainly were for flavored alcoholic beverages, which are popularly known as alcopops, and they were mainly colorful and sweeter, and they were packaged in curvy or sort of shapely-looking bottles. And apart from gendered advertising, young people in all of three sites also took photos of adverts that clearly emphasized the cheap price of alcohol, and that you can see that exemplified in the photo on the right. So study participants in all of the three sites again discussed youth drinking patterns and how they are influenced by alcohol advertisements and promotions. And we saw that binge drinking, or drinking to get drunk or drinking to get intoxicated, was considered to be common among young people in all of the three sites. And some young people also further linked binge drinking to economic consequences of alcohol use among young people. So the photos on the left illustrate this, and the quote basically is from our South Africa side, and it reads, "There is some madness in how we drink. The thing is, we buy 5 liters and you want to finish it in one night. You want to drink all of it. They drink to get drunk. They would even tell you, why am I drinking alcohol if I'm not going to get drunk?" So the photo on the right further sort of illustrates the same thing, but then the quote highlights binge drinking and further links it to possible economic consequences that result from drinking too much alcohol.
Thank you, Haika, for that. Photovoice participants, the youth who participated, also brought out a lot of themes around consequences of alcohol. And of the many themes that emerged out of the discussions and the workshops, themes of violence, and particularly sexual violence and risk associated with alcohol, really stood out across all three countries. So as you can see in the photographs over here, it acknowledges, the participant quotes actually acknowledge that there is a risk of violence after drinking, that there is a risk of being sexually assaulted, or there is a risk of lack of safety when you're walking alone. There is a fear of being assaulted, as has been acknowledged in both of these quotes. So for example, the photograph on the right is not a real photograph, but it shows the fear of a participant of being assaulted. And if you can look at the quote, it says that this young lady is very drunk and a man on the street pretends to help her, but instead ends up raping her. So this was a very predominant concern that was voiced by these young people. So just as participants spoke about the risk of sexual assault and sexual violence, participants also spoke about experiences of domestic violence that some of them said that they witnessed at home or in the communities that they live in, which were all related to alcohol consumption. For example, the photograph on the right depicts a scene from a participant in the India site, which talks about their father or uncle inflicting violence upon family members after being drunk as being the routine scene in his life. Whereas on the right you see a photograph, on the left you see a photograph where participants also spoke about how very often consumption of alcohol makes people lose their inhibitions or lowers their ability to negotiate safety, sometimes which ends up in unintended pregnancies and a lot of regret in the lives of young people. So violence, the risk of violence, sexual risk, exposure to domestic violence, and regret were all consequences that youth across all the three countries very consistently identified. One particular aspect around sexual risk and alcohol was uniquely observed in the South African site, where the Photovoice data revealed that very often sex was used as a currency for alcohol. This form of sex, which we call in transactional sex, was reported by young people, where exchanging alcohol for sex often with older men, was acceptable, and young women would go out without money and didn't pay for alcohol, knowing very well that in return sex would be expected from them. The quote below is very telling. It says, like you get used to drinking Friday, Saturday, and Sunday, you are on. You don't want to be at home, just want to go out because you can't afford to buy alcohol every weekend. These are some of the things that make people want to go to sugar daddies. Then they want you to go sleep with them. So this is a very telling quote.
Yeah, so here in this slide, we conclude and make some recommendations for policy and also for interventions. So in Tanzania, there is no alcohol policy at the moment. We're in the process of having one, hopefully soon. So there is need for a policy in Tanzania. In India and South Africa, the alcohol policies, but as you've seen from the findings that the implementation of what is stipulated in these policies needs to be strengthened. For example, prohibition of alcohol sales to minors. And then policymakers and officials and the stakeholders, we need all to ensure that alcohol adverts don't target youth in these countries and these communities. Even though the industry sees young people as what they call an emerging market, we should really ensure that that doesn't happen. Alcohol selling outlets shouldn't be near education institutions, whether it's schools, primary schools, secondary schools, or colleges. For example, in South Africa, we have a law that they shouldn't be within 500 meters from the schools. But from what label presented, you can see that a lot of the outlets and advertisements were within this parameter. We also need to bring together all young people and really make sure that their voices are heard in the different forums, in the communities, but also at the national level, really to raise these issues that we've found in these studies, that they need protection as a vulnerable group. So, and the young people who participated in our studies, they were quite keen to be involved in the dissemination or policy engagement meetings that we were planning. So really, we should provide that platform for them to be part of the voices. In terms of interventions, clearly we need interventions that address alcohol use among this group, as we've seen in our findings. We see there are certain norms that that are existing. For example, issues around masculinity, binge drinking, the issues of transactional sex, especially for girls. All these need to be addressed within interventions. But also unsafe sex or casual sex, which happens after use of alcohol, and also sexual violence. So really, we need structural interventions that address this in order for us to get the impact that we want. So that is the end of our presentation, and we would like to thank all our study participants in all the 3 countries. We would like to thank the central and local government officials who were quite helpful and supportive of these studies in the 3 countries, and would really like to thank our funder, DFID UK.
So thanks so much to the working group. That was a really thorough and amazing presentation. And I'm sure people have many questions, but in the meantime, I wondered if I could ask a question. I think the methodology is also particularly of interest to many people, and I wondered if you could very briefly outline the steps in preparing to do this undertake this kind of research. What did you as researchers, what kind of preparation, and then how did you work with the young people?
So, Lebo, do you want to start on that one?
Okay. Okay, thanks, Terry. Thanks, Annie, for the question. So we got ethical clearance from each of the 3 countries through our ethics committee. So for us, that was the first step. We had developed a standard or a common protocol that we could adapt in order to submit to our respective ethics committees. And once we got ethical approval, of course, there were delays, and I think Preeti could share some of her experiences where in some instances, we needed to go through 2 bodies, which then delays on its own because it means you can't begin the study itself. However, once we received ethical clearance, and in some cases, there were minor, whereas in some not really major changes that needed to be addressed, especially around safety or risk elements with giving young people cameras. What do we do if, they're stolen, they're threatened, just to make sure that they're safe. So after we addressed all those, it was easier for us because then we received ethical clearance, and we then recruited through NGOs, through institutions, in the respective sites, as well as employment or employers, and we got young people then who volunteered to participate in the study. So I think for us, just going through those processes, ethical clearance, recruiting young people, getting venues, making sure that we have the cameras, teaching young people, it enabled us to really collect the data, and constantly engaging with them over 6 weeks allowed us to deal with any challenges that we came across. In the case that a camera was lost, which we experienced in South Africa, and we went to the police for them to give us a case number and to replace it through our insurance.
Would like to add to what Lebo said, that in terms of ethics and taking the actual photographs in the field, I think each of our 3 countries had very different experiences. I'll share that in India, the IRB, or the Ethics Committee in India, did not want us to photograph faces of any person, and wanted us to use anything, just the backside or just the head or just the hair or even symbolic photographs. So we had to do a lot of that, and we were not allowed to use digital cameras. So we were only, because this is the same time when India has seen some scandals around photographs being misused of young girls. So as a compromise, the ethics committee said that we could use those old, the disposable cameras. And that compromised on the quality of photographs, and we had to scan everything to make them presentable later on, say for in the PowerPoint today. So that was the experience on India's side.
Yes, yeah. This is Per Andersson in Sweden. Thanks for a very nice presentation. And I have quite some experience from working with the issue in various parts of the world, not the least Tanzania and also South Asia. I see that one major problem is not the absence of policies, but the enforcement, because it's being again and again delayed. And there are actually legislation in most of these countries, but it is not being enforced. So what is your experience of that?
Lebo, do you want to start first? Give us some experiences from South Africa.
Okay. Thank you, Jerry, and thank you for that question. So in South Africa, we have good policies in place. However, we have found, or the debate is that implementation or enforcement is a big issue. However, even before that, we have a good draft policy on the control of marketing and alcoholic beverages. However, due to a lot of political issues, it's been delayed in enacting it. And we also have the National Liquor Policy, which was amended in 2016-2017. However, these policies have not officially been passed so that they can really be enforced. So for us, that's the issue, where documents are in place. However, enforcement can be quite an issue. we also have a policy called the National Norms and Standards, which enables different provinces, which is what you call states, to stick to the same laws in terms of how they allow traders to trade alcohol in their respective provinces. So this is the one where issues of trading hours are specified, issues of safety, issues of ensuring that there's food, there's water, there's condoms for people to use. However, you find that in a lot of communities, this aren't implemented, and the police services are the ones who are supposed to be enforcing. However, you also get issues around that, in that they are not always enforcing those, and they are not monitoring to make sure that all the outlets comply. Or when they do try to enforce them, communities tend to want outlets to trade for longer because they're having a good time. So there's some debates around, do communities always allow the traders to stick to the laws, or do the traders themselves comply? So there are issues of making sure that the two parties work together, and the police actually comes in to ensure that those are enforced.
Thanks, Lebo. Preeti, do you also want to say something from the Indian context?
I was saying that India, in fact, has some of the most stringent and prohibitive policies in Asia. Despite that, if you like, the minimum legal age of drinking in Mumbai, Maharashtra, is 25. If you look at all the participants who participate, the oldest was 24. So technically below the legal age of drinking. And though the study did not ask participants whether they do drink or how much they drink, we were not interested in that data. Everybody said it, that they've already had their first drink when they were 16. I think the problem with implementation here is that there is a conflict, that the alcohol policy is not geared towards public health. It's geared more towards profit making. And that's why, though the policy does exist on paper, it doesn't get implemented because of the lack of will. So I think that's where the real problem is. The whole point of doing the mapping exercise in this study was to give that lack of implementation a face, a data to show that this is what it is. Like in India, the law says that there should be no alcohol outlet in 100 yards, which roughly is 91 meters, around an education institution, around a temple, around a place of worship. There's a list of places where it can't be around, and we found so many in less than 100 meters. So we're hoping to use this data to reach the correct years and say that, the policies are there, but the evidence says that it's not working.
Thanks, Preeti. So, Mitzi, I see that you've raised your hand. Please, can you ask your question?
Thank you all for a great presentation. I've got two, but I'll ask one and give time to other people first. So I know that you have condensed a huge amount of data into this presentation, and I was struck that a number of health risks came up for young women in terms of sexual violence and pregnancy, etc., but that actually the risks for young men were mainly concerns around financial. Did concerns about health implications come up for young men? For example, were young men concerned about the risks of getting girls pregnant when they were under the influence of alcohol in any of your data?
Thank you for your question, Mitzi. So for the Tanzania site specifically, most of the group discussions, if not all actually, really did focus on the health risks for young women. And there was very little, almost no mention of health risks specifically for young men. For health risks that were discussed that also implicated young men, they were mostly the ones referring to both groups. So for example, experiencing problems with your liver or getting cancer from long-term alcohol use. But yeah, it was very interesting that most of the health risks were focused on young women and not young men.
Okay, and in South Africa, we did get young men, similarly to young girls, indicating that issues of unsafe sex or unprotected sex happening at alcohol outlets because they knew that the law demands or stipulates that there should be condoms made available in outlets. So when they do try to look for them and they don't see them, that is a problem because then they would want to use them. However, some of them did indicate that when you are drunk, you also get this inhibition that you forget that you need to use a condom. So even if condoms are provided in the outlets in the case that they wear or they do have them with them, they forget, so they don't use them. So it was clear that young men were also quite concerned about issues of contracting HIV, as well as pregnancy, because for them it was, if you do have unprotected sex, you stand a risk or a chance of contracting HIV or impregnating a girl, and because that was not the intention. You're going there to have fun. It's a risk that is quite a challenge for them because they would not want to impregnate a girl because they were young, or they would not want to contract the HIV because all they wanted to do was have a good time.
From the India side, thanks, Mitzi, for asking that question. Men did talk about health risk to themselves, but it differed. As was mentioned in the beginning of the presentation, we consciously made a choice of recruiting groups of youth from two different socioeconomic strata, and that's where the findings differed. So youth who came from poorer communities had seen a lot of consequences of alcohol around them, and they cited issues of, your liver gets damaged, you lose weight, and none of the medication will work on you ever if you drink alcohol. But the sexual risk part did not come out. In youth from middle and affluent families constantly talked about, particularly the male participants, talked about risk being that of dying in a road accident as being a consequence or a health hazard from drinking alcohol. What was interesting is that almost in both groups of youth in the data, there was a lot of argument in the particular exercise that we had, where people heavily kind of tended to agree that alcohol actually is good for your kidneys. So there was a lot of discussion about that. My doctor said that you can have a bottle of beer to my father when he had a kidney stone. And maybe, beer is not such a bad thing. And people reading everywhere on newspapers or on the internet or somewhere that, one glass of red wine is not a problem. So people kind of justifying saying that I don't drink beer, but I drink wine. And I think it's okay to drink wine. So those are the kind of misinformation about health is what also emerged from our study site.
So sorry, Jerry, through you, Chair. Just to add to what Bridget just said, so there were also some references to fetal alcohol syndrome with young people indicating that alcohol outlets do allow pregnant women to get into taverns, which is part of a lack of compliance in South Africa, that then the consequences are that the unborn children or babies get to be harmed. There was also some reference to interpersonal violence and injury, that when they are intoxicated, it is easy for a fight to erupt, especially amongst the young men and not so much the young girls. Thank you.
So I have a question from Lawrence. So he asked, I'd like to know how many people were interviewed in each site and how were they recruited. So he just wanted to get a sense of the number of people who participated in the group in the group discussions and how we recruited them. So perhaps Aika, do you want to start?
Yeah. So for Tanzania, we had a total of 33 participants, and in our Mwanza site we had 12 men and 8 women who took part in the Photovoice workshops, and then in Kilimanjaro we had 8 men and 5 women. And we recruited young men and young women from their places of employment, so they were either employed in the formal or informal sector. So for young men, we recruited them from their working sites, and they were either carpenters, welders, or construction workers. And for young women, we recruited them from mainly 2 types of working sites, so they were either tailors or food vendors.
Yeah, so basically in Tanzania, we did purposive sampling. And as Aika has just said that, so each of the groups was taken through a series of discussions. So one group would be taken through a series of 6 actually workshops. I think that is how it happened. So I'm going to hand over to Lebo to describe that in South Africa.
Okay, so thanks, Jerry and Heike. So in South Africa, we recruited a total of 32 young people, 16 in the urban and 16 in the rural. However, 5 dropped out in the early, I think, by the second workshop, and this was due to family commitments or school or finding employment opportunities. So these young people were unemployed, or either unemployed or in their high school or at college. So the way that we recruited them was through the NGOs, where Soul City as an NGO actually has a footprint where we're implementing HIV prevention programs. So we recruited young people through those programs, and the young men were recruited through the local NGOs where the Rise Young Women's Clubs, which is the HIV prevention program, was implemented. And they volunteered, so we just told them about the project, and then they volunteered to participate. And of course, because participation is voluntary, some of them dropped out by the second workshop.
Thank you, Lebo. For the India side, we had only 2 groups, so of 8 participants each. We recruited youth, so because I said earlier that we were targeting to recruit group to represent 2 different socioeconomic strata. So we did purposive sampling. In Bombay now, Mumbai has colleges which cater to different kinds of communities. So there are private funded colleges which attract students who typically can afford a high fee. And then there are community colleges which usually teaches youth for free, or they have night colleges where young people who are working through the day attend college at night. So we posted advertisements in these colleges, and we also chose colleges from within the areas where we did mapping, just to see that what we were finding around in the mapping, does Photovoice throw any additional information on that. And we had posters with the college's permission, and we had asked you to get in touch with us to know more about the study. Trust me, we thought we'll get a whole lot of people, but when they heard that they had to spend weekends with us doing the Photovoice workshop, and they had to go around, take photographs, come back, caption, and do the workshop, we just got the number we needed. So that's how we recruited for the India side.
Sorry, and just to add that young people were incentivized or compensated for transport. So across all the study sites, as part of our even ethics application, so for every workshop that they attended, we gave them about $12-13 US. And this was mainly for transport, because we provided them with refreshments at their workshops.
Okay, thank you. So we have another question from Beth Kangwanga, and the question is, I wanted to know if you evaluated or you saw any differences in alcohol use by the youth between countries with alcohol advertising laws, that is India and South Africa, compared to Tanzania. So Beth works with the Population Council in Kenya. So just to kick off, perhaps answering that. So this, as we've said, this was a qualitative study, so we didn't really set out to establish the use in terms of and comparing, but we have these impressions from the different countries. So now I'll invite Heike to talk a little bit about Tanzania, and then we can proceed. So in terms of use, what did we see here?
So for Tanzania, in terms of use, we mainly saw alcohol use is maybe more widely reported to be used by young men as opposed to young women, although young women did talk about using alcohol, but it was more so mentioned to be more common among young men. And I think that's also really interesting because, I mean, I think compared to the 3 sites, in the Tanzania site, it's the only site where we saw advertisements that exclusively target young men, and we really did not see any adverts that were specifically sort of communicating to or sort of reaching out to young women. So I think that sort of gives an interesting reflection between, the way alcohol is sort of reported to be used between men and women.
Thanks, Heike. And we would like to refer our colleagues. We have there was a publication from one of our team members here in Tanzania, Joel Francis, who did a systematic review on alcohol use among young people in the Eastern African region. So if you visit the Strive website, you will be able to see that. So it really gives you sort of an overview of use within the East African region. And as Heike said, generally, if you compare between men and women, or male and female, there's higher use among males. So I'll invite now, should I start now with Preeti to talk a little bit about use in India, and then perhaps Lebo will finish.
Yeah, thank you, Jerry. So I agree with Heike, and I would say the same in India, that young men reported consuming more alcohol than women. However, there's a class dynamic here that we observed. And as Jerry said, we do not have like quantitative data to make an assertive statement about that. But there's a class difference in the way young women accessed alcohol in India. Say, for example, young women who are participating in a Photovoice, first of all, reported age of initiation, which was, they said, now commonly you're 13 and you're drinking. The second thing is that most people reported drinking at home with their own parents, so that's a completely new dynamic. Third is people are very brand conscious. So the youth drink, but they're very clear about not drinking the local liquor, but drinking the IMFL, that is the foreign liquor, because they feel it is good for health and it's cleaner. So those are the differences. And you do look out for promotions. They do look out for deals, which give them alcohol at a cheaper price. So binge drinking was consistently observed across both our groups, because otherwise alcohol is still considered quite a taboo here. But when they drink as if they'll not get to drink ever again. So binge drinking is common, and to our surprise, binge drinking was found both among the male and the female participants. In fact, the female participants time and again said that there are no different drinks for women. Women can also hold their drinks as well as men, and we very often at our parties prove it to them. So that was quite a startling finding at our end.
Okay. Thanks, Jay. So in South Africa, generally the trend for us is also that males drink more than females. However, in our study, when we had focus group discussions with young people, they generally indicated that both males and young females drink, and this is, for them, it's a form of entertainment. So generally, the norm of binge drinking around the weekend, around the holiday seasons, the festive seasons, when there's parties, when there's events, during school trips, during traditional ceremonies. For them, it's a means of entertainment, it's a means of having fun. However, they also indicated that binge drinking generally is encouraged or facilitated by promotional activities that also tend to happen, such as discounted sales or bulk buying, which often happens around festive holidays, or whenever people then have events, they go and they can check at the shops what's available for on discount for them to purchase.
Thanks, Lebo. So I'm conscious that we have just about 5 minutes, so I'll take the next set of questions from the chat box and request our colleagues just to quickly respond to them. So the next question is from Sian Long, and the question says, I would like to know if you have discovered any examples of initiatives that explore adult, parent or caregiver attitudes and behavior towards alcohol and how this affects young people. So essentially, the person is interested to know whether we discovered anything that addresses any initiative that addresses parent or caregiver attitudes and behaviors towards alcohol, and especially in relation with young people. Any response from our three presenters?
Jerry, if I may say something, we did not find any initiative that is talking to adults or parents. But what we did find that initiation into alcohol these days, at least in the middle and affluent classes, seem to be normalized or occurring within the families itself. So that was one thing which for me is a pointer to say that we do need an initiative to talk to parents, but we don't have one.
Okay. Thanks, Heike. If I can come in, Jerry. So in South Africa, we generally found out that parents also somehow facilitated, young people's drinking behaviors. For instance, we generally tend to celebrate 21st birthdays, and when that happens, parents buy their children alcohol, and that will tend to be available for everybody. At a 21st birthday party, you have 18-year-olds, you have 17-year-olds, so drinking generally is normalized. But even beyond that, parents, so also at traditional ceremonies, young men are allowed to consume alcohol, also as a means of initiating them or welcoming them into young adulthood. We also found out that parents tend to send their children to buy them alcohol. We call the secondary provision of alcohol, where they will send minors to an outlet to buy them alcohol, and the law says they shouldn't sell alcohol to underage children. But so you find it in both ways, that at taverns or at bars, an adult will sell alcohol to a minor, even though the minor may say, I'm sent by my mother. However, sometimes they lie even when they want to buy alcohol for themselves and not their parents. So there was generally a sense that it's normalized to send children to get alcohol, and also at events, at weddings, alcohol is widely available as a form of entertainment.
Thanks, Lebo. And Nina Maria wanted to know if we had any specific recommendation in relation to sexual violence or sexual assault. Any particular recommendations from our findings? So perhaps we should say that our main recommendation is that any interventions, alcohol. We know that alcohol use and violence, as we've seen from our findings, they go hand in hand. So any intervention to address alcohol use among young people, especially either young men or young women, it should have messages targeting or talking about violence, because this was one of the things that was highlighted by the participants, that it happens in their communities. And then the next question was from, just the final one was from Mark. His question is about advertising, and it's not about advertising, but I wondered whether the alcohol industry has been active in schools in South Africa, Tanzania, and India. So he's asking whether the industry really has been, did we see any activity of the industry in the schools in the three countries? I don't know, quick responses?
So just quickly from us, generally there's a lot of sports sponsorship by the alcohol industry, so you see a lot of their banners, their advertisement during sporting activities. So that's how we know that they're engaging with the schools. And at those events, even at a soccer match in the community, you'd find that then maybe a particular product or alcoholic beverage would be sold at that outlet. So generally they promote or they engage with young people through sports in that way in schools.
Preeti, anything from India?
No, same as Lebo. They do not reach out to the school directly, but they reach an age group through their promotions and marketing, but not within the schools. So
perhaps I should just take this opportunity to really thank our presenters from the three countries, so Haika from Tanzania, Lebo from South Africa, and Preeti from India for such a fantastic job of putting together. I know that we have a lot of findings, a lot of things to say, but this was excellent. And we really thank everyone who joined, and especially for those who had questions.